welcome to everybody to our launch of the Idea Centre. My name is Catherine Loftus. I'm the Director of the Education Alliance for Life Chances, working with the Centre of Applied Education Research here in Bradford in the UK. So welcome to colleagues both in the UK and the US. It's great to see everybody today. So it gives me great pleasure to welcome our first speaker, to welcome you formally. It's Professor John Wright from the Bradford Institute of Health Research. He is the Chief Investigator for Born in Bradford. Can I hand over to you, John?
Sure. Welcome to those who are tuning in, and a very warm Californian morning, I presume, for our colleagues in the US. Just really to start with a thanks to Mallory and Catherine, and in particular Mark, whose idea is, if that doesn't sound too tautological, is it? This is a much needed step in our journey towards how we harness the vast amounts of public data out there for public good. So I'm going to start with my own personal journey with this, which came when we set up Born in Bradford in 2007. Born in Bradford's a longitudinal birth cohort study. It's involving about 60,000 Bradfordians now, but really focusing on looking at the determinants of health and well-being in children and how early life is particularly important, adolescents now as they're growing up. And we collected a vast amount of data on these children and their parents. Both research data from questionnaires, but also biological data. So we've got exome sequencing, DNA sequencing, detailed metabolomics and proteomics. We can count the number of amino acids in children's blood samples. So a remarkable level of data that we have. But the surprise for me, when we set the study up, we consented the parents to share the routinely collected data that we have in the health service and across education at the time. And actually, it's just the data that we collect routinely that has perhaps been the most powerful. So for all the fantastic omics and cutting edge science that we're able to do, it's the data that we have within our own health services, within our own schools, that's been so important. So for example, showing the impact of air pollution from on low birth weight and prematurity, on childhood asthma. That was linking environmental data from the local government through to our health service data. Looking at autism and early identification in children using reception school data assessments, really powerful, and that's been used to redesign services for autism in the city. So we're using this data. It's a remarkable source, and as time has gone on from 2007, that data has got richer and richer and richer. So one of the next steps we did after Born in Bradford was to think about how we could do this for the whole city of 600,000 people. And one way to do that, so for Born in Bradford, we consented individually, everybody. That was a harder thing to do. But to find a safe and secure way of doing that, we set up something called Connected Bradford, which links data for 600,000 people safely, securely, anonymously. So this is what we call pseudonymization. We need to link data sets using identifiers, but then we collate it and store it in anonymized databases. And so we did this across primary care, secondary care data, emergency care, education data, social care, local government data, and increasingly with Nick's help and Dan Burke's help, we're doing it with crime data as well. So this sort of pulling together this fragmented, these different lenses that we have of people's lives to see how we can use data to support children and their families earlier in life, to identify and target support when they're most needed. Now, there's two key elements of that, which I think are really important. Firstly is the public engagement. This is our data. This is my data. It's your data. We've got to be very transparent about how we use it. And we've got to bring people with us. In the UK, people will know about previous car crashes where central government has tried to sort of unilaterally use public data, health service data in particular, really without people's explicit consent. So we set up, as part of Connected Bradford, citizens juries. That process of engagement and discussion and prioritization about how we use data is an ongoing journey for us all, really fundamental. So the other pillar to this is how we use that data. So the Idea Centre is a great opportunity to bring together the greatest minds, that's you lot out there, I hope, to see how we can explore it to use it for best purpose. But it's also how we translate that into policy and practice. And that's really key of embedding this, what we call a learning health system, using data, using large-scale data, not just to describe quite interesting things, but to really ensure that that feeds into policy and practice, changing clinical guidelines in the hospital, for example, changing school admissions programs, changing services designs for autism, for example. And what we've been able to do in Bradford, for example, is implement a very ambitious clean air zone on the back of the evidence that we developed 10 years ago using this routine data. So it's really exciting, the possibilities. This is the place. We're ahead of the game in terms of what we're able to do. And because of Born in Bradford, that built the trust in our community, in our public, to how we're using the data. Connected Bradford is the next stage, but we need great analysts. And that's what the purpose of the Idea Centre is to really have this crucible of data analytical capacity so we can do great things. So what a great idea is. And on that note, I will pass back to Catherine and back to Anne.
So as I said in the beginning, I will be chairing our way through the next hour and a half we have together. We've got presentations from both Leeds University here in the UK and also Stanford University. And then a bit later on, we'll have a brainstorming session where I'll be facilitating how we develop our community of practice and how we might start to do that. But before we have the presentations, it gives me a great pleasure to introduce Anne Longfield, CBE, who was the former Children's Commissioner for England and also the current chair of the Commission on Young Lives. So I'll hand over to Anne now, who's got 15 minutes to give our keynote speech. Thank you, Anne.
Brilliant, thank you. And really pleased to be here. Hello to everyone in this country, in my hometown of Bradford as well, although I'm in London today, and everyone over in California. It fills me with envy of the climate you will be sitting in today. I've worked around children's policy, children's services, government advocacy around some of those issues for, well, a lot of years, but at least 30 of those. And within all of that, I've seen the increasing sophistication of understanding of how we can better support children and children's lives, especially those that are the most vulnerable. But in all of that, if we had to have it on a scale, how many steps were we along the way? We are still very much, I think, naturally in the early days of really harnessing the power and potential of using expertise, of using data, of using many of the things and approaches that actually other sectors take for granted to the common good of children, and really to be able to boost the life chances of children who need the help most. So I'm really delighted to be here today to mark the launch of this really important initiative. Congratulations to Mark on this fantastic venture, and one that I know I and others will really want to get behind and really make a difference, because I think the really important here is the collaboration between, yes, of course, all of that expertise in academia that can really start to drill down in that understanding, but also really to skill up those people who are delivering services, who are working with families, who are translating that into the best possible policy and outcomes that we can achieve. And that, I think, is a revolution in what in this country we hope to achieve. And what I would say to everyone on the call here today, it's a revolution I think you are fantastic collaborative partners in. I would also say potentially leaders in. So I suppose, you know, I'll start with the message that I'm going to end with as well is I want us all to be kind of warriors for those children and use every scrap of the knowledge, expertise we can to really turn the tide on what sometimes can seem to be huge, intractable social problems. I think I'm an optimist in any case, but I think there are solutions. I just think we have to get better at finding them. And it's right, of course, that we do put our energies into childhood. It's an absolutely crucial part of all our lives. If we think back about what childhood meant to us, the experience of childhood really had an impact on what we do in our professional lives as adults, the relationships, the way we see the world, and indeed our life chances and life expectancies. A poor childhood can be a huge hurdle to overcome. A brilliant childhood could be a huge springboard into life. And I know you will want as many children as possible to have the springboard that we all know and believe they could. And I think there's wide agreement that our systems of support in this country need to get better. But so often the people who are actually delivering those services, the councils, the housing associations, the schools, the health trusts, they just don't have the scale or the resources or even the time to be able to apply themselves to innovation and to the kind of reforms that we're talking about. And what we've seen in the UK is that the level of demand for support has increased. And of course, with that, we've also seen that alongside decreases in budgets in many areas. There then gets to the point where the emphasis is on crisis intervention. There is less and less time to look at innovation and more time having to be spent on the crisis and the needs of the day. And if we look at those local eco centres, and I'm really pleased that this venture is all about place and all about building the sustainable eco centres that we know could flourish and are so important. If we look at the majority of local eco centres now, they're a collection of agencies that often have different professional cultures. They often have different missions, different targets, and their own professional ways of working and their systems to do so. And when things go wrong and there is a review of why that happened, you will always find that the gaps between those services and the differences between those services and the lack of clarity of where responsibility lies are the places where the most vulnerable children, they fall through the gaps. And sadly, within that as well, you see too many instances where services aren't working adequately together and indeed aren't sharing the kind of data and information that we would all want. And that isn't a criticism necessarily of those agencies. Many of them are doing what they've been told and what their mandate is set out to do. But I think we need to do more than that. And I think that what we're talking about today is part of that vehicle for that change. So I think the ambition is that we deliver coherent, intelligent, evidence-based and informed support that's able to identify those problems early, intervene early, and put that support in place to prevent problems escalating. And this, of course, is where this new venture and collaboration comes in. And I think already, you know, you've got here esteemed organizations at the forefront of developing understanding, techniques and approaches. And there now is, I think, that real opportunity to apply this for social good and focus in that with children. Now, this is something that I have been very interested in for some time. When I was Children's Commissioner for 6 years, my role was around advocating for children with decision makers, often those in government. And I knew that actually having the evidence to support my case was really important. So I had the privilege to work with Professor Liam Feinstein, who worked with me to set up an innovative framework of vulnerability of childhood, 144 different indicators of vulnerability, which we're able to gather using administrative data and data that we collected ourselves, as I had some statutory powers for data gathering, and present that in an ongoing, annually recorded, annually presenting framework of vulnerability for childhood in the UK. We broke it down into place-based vulnerability indexes and actually into constituency areas for politicians, because of course, you know, as part of any kind of conversation with a politician, they'd always like to click on their area and see what the data said to them. But I felt first and foremost that was absolutely essential, because when I came into the role and I went into different government departments, I was often told that the minister of the day was very concerned about vulnerable people, very concerned about vulnerable children. And when I asked, well, what does this mean? How are you defining vulnerable children? I was usually told and given a description that would tie really closely into whatever the responsibilities of that department was. I'd be told that, well, this is about pupils at risk of becoming falling out of employment, falling out of training, education, and into unemployment or exclusion. I was often told that I was talking about patients at risk of hospitalization or even morbidity, prisoners who were at risk of reoffending, residents at risk of homelessness, all the different ways to describe parts of the child where the symptoms of that vulnerability were being seen, but not in that way getting to the root causes of that vulnerability, underlying the deep-seated social problems that we knew had to be tackled unless, if you were really going to tackle some of the symptoms too. And usually they were poverty, often around vulnerability in families at home, often around the experiences as those children grew up. And with our collection of data, we were able to show that actually in this country, there are around 2.3 million children, and that's about 1 in 6, who were growing up in vulnerable family situations. And these were situations where someone in the family at home had severe mental health, where there were addictions, or where there were domestic violence, all of the drivers we know to accelerate vulnerability and often drive children into care. And when I visited children in custody, which I often did, 15, 16, 17-year-olds, clearly at that point, things have gone very wrong. And I'd often say to them, you know, how did it get to this point? And what they would tell me back was almost became a blueprint that would be told again and again. There were problems at home. My mum had didn't get much support. There was domestic violence. I had to go live with my grandparents. I had problems in school and were excluded. You know, there was this constant blueprint of how things go wrong. And it seemed to me that knowing that and understanding that, we had to get better at noticing, getting ahead of the game and doing something about it. Now, of course, a lot of these things were exposed as part of the pandemic, the kind of weaknesses of the system, but also it did show how things could be done differently. And just a couple of reflection points. Yes, it showed where the holes in a lot of the data is nationally, and they're still there, despite the fact there's some really good new linkages. But it also showed at national level, what would happen if at senior level of government, it started to collect data from across departments on the whole life of the child. And one of the things that happened during the pandemic was that there was an inter-ministerial implementation group that looked at indicators of vulnerability and could measure that and map that over time. And I think although it was in no way the finished article, it didn't have live data, for instance, and wasn't in any way sensitive enough locally, it started to show what could be if you could put the engine of government behind the mission of reducing vulnerability. And nationally, internationally, and locally in every area, that's what I think we need to strive to achieve. So I really applaud the work in Bradford. The Born in Bradford work is so well known. I mean, not least because Radio 4 play it virtually every month or every couple of weeks. But, you know, this is such an important work, which now has such recognition. The Years of Wonder, again, for me, particularly important because there hasn't been that strong focus on the teenage years and what the impact, both of vulnerability, early vulnerability, and how that follows through there. And of course, the Connected Bradford, so much richness here to draw upon and to learn from. And I think what we've got the opportunity here is to lead thinking, and through this strong collaboration, to be able to look at what strategic, place-based, cross-disciplinary approach to driving improvements really looks like. And the prize, I think, is that we bring this scientific understanding to the heart of local partnerships and to families too. That discipline to understand collectively what the outcomes are needed and what success looks like. It sounds achingly obvious, but those are often the discussions between different agencies, between different partnerships with families that never get to happen. The ability for all those different actors to be able to jointly agree what the questions are. Always, for me, some of the hardest things that everyone finds testing. And then also that collaborative learning in analysing, understanding what the findings mean. This is always going to be always going to be about getting the findings, but also understanding and having that experience and good judgment as well from professionals. But that whole process is one where the richness of learning can be. And the ability to identify those early signs and then have confidence in the kind of responses and the effective responses that come to that. And then that increased understanding of those core drivers and determinants of vulnerability and inequalities, and the ability to be able to argue the case and make the case strongly for a long-term 10-year, 15-year mission and plan of interventions in response. We're never going to be able to drive down some of those deep-rooted social problems in, 1 year, in 2 years, but you can start to see that turn by having a whole range of interventions that can support that, I think, relatively quickly. So a common framework and commitments, data, evidence and outcomes that can shape, that can drive and be the glue actually to effective interdisciplinary work, I think that puts children at the centre, has the huge potential to transform lives. And this is an urgent need. We've all seen the levels of need in some communities, and many, many different indicators are going the wrong way. Poverty is increasing in many areas. Mental health problems are at record levels in this country, fueled often by the pandemic. We know that the disadvantage gap at 16, 40% of that happens by the time children go to school. We've got more children who've been taken into social care in some areas, more children who are falling outside school or not attending school. And for all of that, we know it's a vicious circle. And in this country, we need to reset our whole thinking, I think, on how we support children and how we support families, to be able to engage with families earlier and to do so in a long-standing way that enables them to progress, enables us to support families without them falling off the end of a short-term program. And that, I think, is what the potential and what the ask is actually for the collaboration and this important and rich new venture. I think the potential now is to take this learning, to amplify it, to deepen it, and to accelerate it, to lead to dynamic change. I want people to get excited about the extent of possibilities of what we can do. And in collaboration with the public sector, with schools, community groups, and children and families themselves, I think there's a potential to transform life chances, but also transform what the expectations are that children and their families have in not only what support they can get, but actually what their own life chances can be. We're all looking for ways that we can reduce inequalities. We're all looking at ways that we can boost productivity in parts of the country. It's an issue in this country and internationally too. But here, I think we do have a key tool in making that happen. And I'd really urge you to do everything you can to really find ways to become the warriors that children need us to be, and to be able to really put this on the map as a way of transforming what we see as life chances for children in this country and internationally as well.
Thank you, Anne. I hope everybody's heard the solid call to action there from Anne, for us to unlock our collective expertise, to be warriors for children. I absolutely love that phrase. And it's been really helpful to hear Anne's insights about the potential for the Idea Centre. So I'm going to move us on now, because next we have 4 speakers. We have 2 colleagues from Leeds University who are going to talk about the data engine for analytics, and 2 colleagues from Stanford University who are going to talk a bit more about the synthetic data creation. So I'm going to introduce our first presentation, and that's from Professor Mark Monn-Williams, and he is the chair of the cognitive psychology of the University of Leeds. So over to you, Mark.
Oh, thanks so much, Catherine. And can I just say that actually we don't worry about organizational sort of affiliation so much within the sort of centres. I feel very much I'm speaking on behalf of my colleagues at the University of Bradford, at the Bradford Teaching Hospital Foundation Trust, because this is all about us working together. And can I just say just how intimidating it is to be giving this sort of talk right now, having heard from 4 of my great heroes. That's yourself, Catherine, it's Mallory, it's Anne, it's sort of John, people that I just look up to because of the fantastic work that you're all doing. But what I love about what you're all doing is that it's all different, but by coming together and us all working together, we're making some real sort of change. We're seeing change happen in Bradford. And that's what today's all about, that community of practice coming together, everybody bringing whatever skill set they possess to the table, because we need everybody putting their shoulder to the wheel if we're to make the changes that we need to happen. So every day, my day starts with a cycle ride. Every working sort of day, my day starts with a cycle ride. And pretty much every talk you give now starts with the sort of same discussion of that cycle ride. So Anne and myself live in Wharfdale within the Bradford district. That's shown on the left-hand side of this slide. And I work in the Bradford Royal Infirmary site in Manningham, 10-mile cycle. And the harsh reality that I'm faced with every day is that at the start of my cycle, I'm passing schools containing children who are predicted to live 10 years longer than the children I pass in the schools at the end of my journey. And perhaps even worse than that is that the children at the end of my journey are currently predicted to have 20 years less healthy life. These are well-documented inequalities within health. And we've known about them for decades, and we've consistently failed to decrease those inequalities. In fact, those inequalities have been getting worse. But the point is that those inequalities aren't just sort of playing out in terms of health. We can pick pretty much any demographics that are variable, and we see the disadvantages playing out in all of these different spheres within a child's life, exactly as Anne described. So when we start looking at the data, we start to see the multiple problems that are playing out across our different systems. And this is particularly problematic because, as Anne says, we start to look at the symptoms rather than the underlying causes. And actually, in terms of just trying to tackle those underlying causes, we're finding increasingly that a single agency, a single public service cannot tackle those sort of problems, that the problems can't just be contained by policing services or health services or education services or social care services. What we need is our services to work together effectively in order to tackle those deep-rooted problems. But the difficulty is that the services just don't have the tools that they need, the ability to share information, the ability to see things in Technicolor and 3 dimensions that they need. But of course, we have the tools that allow us to start seeing those intersections and interactions. And that's what today is about, asking how we can start using those sort of tools to start tackling these really fundamental problems. Problems that were really well described by our colleagues across the north of England. The N8 universities came together to produce a report just describing the terrible outcomes that currently face children and young sort of people growing up within the north of England. But in fact, the problems aren't contained to the north of England, they're contained within our most disadvantaged communities. And clearly we have disadvantaged communities, not just within this sort of country, but internationally. And time again, you see whichever country you're looking at, that a fundamental issue is just fragmentation of our systems, that we've allowed ourselves to really start siloing our different approaches, siloing our different services. And the consequences are literally matters of life and death. So as Anne's already described, when we see terrible things happening, when we see children falling between the gaps, we literally see children dying as a sort of consequence. And the question is, whose fault is that? And it's very easy in these situations for us all to blame that service or that service or that agent or that practitioner. But to my thinking, we're all to blame. I'm to blame because I've sat for too long in my ivory tower doing the science and really failing to plug that science into the systems and services. I failed to really connect with the practitioners, even though the work I've done has got practical implications for the way that practice could and should happen on the ground. So today is about all of us parking our organizational barriers, coming together and saying, how do we work together effectively so every bit of the system can work, not just for children and young people, but for people using our health services, for people in employment, and ultimately for people at the other end of the age spectrum as well. How can we start using these powerful scientific tools that we possess in order to start improving life for everybody across our whole community? And we do have incredible assets here in Bradford. Thanks to that pioneering work that John set up all those years ago, we now have the Connected Bradford dataset. We have the records that describe the health of our population, linked to records describing the education of our population. We have rich environmental information. We have rich information about contact with the criminal justice system, rich information about sort of our children involved in sort of social care and so on and so forth. So we suddenly can see things in Technicolor. We can suddenly see things in 3 dimensions. We can suddenly start better understanding how we can reorganize ourselves to effectively start tackling these wicked problems that are playing out. And the beauty of Connected Bradford is that we don't just have these huge data sets describing the whole district, but we then have multiple cohorts that are even more richly described genotypically and phenotypically. So Born in Bradford is one of the headlines of our stories, but John and colleagues have recently set up other cohorts. So intervention cohorts like Better Start Bradford, other cohort studies like BIB for All. And this is work that isn't just happening within Bradford, but where we're pushing out that sort of a learning. So we then start sort of seeing how other areas, nationally and internationally, can take these type of approaches and start driving the information gathering that we need to properly understand problems and properly start finding sort of solutions. And the work isn't just contained within Bradford. We work with a number of brilliant sort of colleagues, our colleagues on the call today from sort of Stanford, but also other colleagues in Denmark, colleagues in Bristol. And what we can then do is bring together the learning, not that's just happening within sort of Bradford, but we can then compare and contrast with other areas like sort of Bristol, and we bring all this information together so we can really start understanding where can we intervene to make changes to people's lives. How do we start tackling that mental health epidemic? How do we make sure that children don't get excluded from school? How do we stop those children entering the criminal justice system in the first sort of place? So we have these incredible resources. And one of the issues that we have with all these resources is that the entry barrier for academics to start accessing these very sensitive data sets is high. So that's why a particular focus of the Idea sort of Centre in its first outing, if you like, is on synthetic data. So how can we create digital twins of these incredible data resources that really allow our academic community to come together and start exploring where those early interventions could be put in place that are maximally effective, both at an individual level, at a family level, but also that ultimately can save our society financially. So we can really get that political sort of a buy-in in those early investments in children, young people that we all know are necessary. But as Anne says, we really need that information, that evidence in order to get our policy makers to start driving forward those sort of changes. And what happens when you start doing this? Magic happens. So John's already alluded to the fact that when we started to pull together the data, we could suddenly start better understanding where our systems aren't working effectively. We could suddenly start to see the structural inequalities that sort of play out, where children from particular ethnic minority groups are not having their neurodevelopmental needs met early. We can start to see where disadvantage plays out within our districts, so we can then target our resources more effectively. We can start to identify the factors that prevent people getting the services that they need and deserve. So, for example, we start identifying where mothers without educational qualifications are finding it difficult to access particular services, and we can then use that to reconfigure the services that we're offering across our district. And John's also alluded to the work that's happened that's shown that how we can use our connected data to identify vulnerabilities, identify need much sort of earlier in a holistic way. And we can then use that to start joining up our health and education systems. They are working more effectively, so information does sort of flow. And all of this is coming from the underpinning sort of science, from the fact that we have scientists working with policymakers, working with sort of practitioners, working across our different disciplines, working across our different services, everybody coming together to get these holistic sort of viewpoints that we really need to drive the changes that have got to happen. Those changes that are literally a matter of life and death. And the more that we sort of delve into this, the more we start seeing the power of this sort of approach, and the more we start understanding how we can identify need early and starting to show that when you put support in place early, so you start stopping those horrible downstream consequences of school exclusion or children becoming unemployed, and all the long-term physical and mental health issues that then follow on from that, and that ultimately then sort of cost us so greatly, again, at an individual, family and societal level. So we have the tools that we need. We have a track record of being able to take these approaches and drive real change. But the problem is that there's a tiny number of individuals who are able to support this work. And that's why we need a community practice. We're not proud within Bradford. We need help. And this is an impassioned plea for everybody to come and help us. And as Anne said, this is a fantastic opportunity to show real leadership in this area, to demonstrate the art of the sort of possible. So we don't just change things for children and young people and older adults within the Bradford district, but rather we create a playbook that can then be used in California, in Bristol, in every part of the world, really demonstrating how we can use the power of data science, how we can use information theory to drive change. So you've had all those organizations in Silicon Valley showing how these techniques can be used to increase sort of profits of companies or increase the private wealth of individuals. The time has come for us to come together and start saying, how do we use these public data sets for public good? So we can create these incredible scientific insights that will really allow us to change the way that we do things, to allow us to work together more effectively. But we can also start to use these different approaches to allow the amazing individuals within our local authority, within our police systems, within our health services, within our education systems, to do their jobs more effectively. We can create the digital tools that they require in order to allow secure information sharing, in order to use the power of combined information to properly support a child and family's sort of needs. So that's the call to arms that we're making today. Please join with us. Please bring your skill set, whatever your skill set is, bring your skill set to the table so we can work together and make the changes that we all know need to happen. This really is a matter of life and death. And that's where I'll leave it sort of for Catherine. Nick is now going to just talk through some of the ways that he has seen his skill set can be brought to bear on the data sets and resources that we possess within Bradford. So if I can hand back over to you, Catherine.
Thank you, Mark. And we will move straight to our second presentation, and that's by Nick Mallison from Leeds University. Nick, over to yourself.
Thank you, everyone. So I'm only going to talk for a couple of minutes, and I wasn't actually going to start with this slide, but I think it's very relevant. So I've got the pleasure of giving a keynote presentation to the Geographical Information Systems Research Conference in Glasgow, and the title of the talk, I gave it yesterday, was Virtual Mirrors or Smoke and Mirrors. And basically what the talk was about is some of the really fun, exciting, interesting research that we're doing in Leeds on machine learning, some AI, some agent-based modeling, and we're trying to construct digital twins of processes in cities like crowding. But what the talk is about is it's kind of about that research, but then it finishes by asking, are we kind of are we modeling the right things? Are we looking at the right kind of areas to really try and help people? And I think some of the things that Mark and others have highlighted today is that there are serious issues that some of this science could be applied to, and why aren't we? Why aren't people like me looking at the fact that there's a 10-year life expectancy difference in somewhere like Glasgow, and maybe some of these really good methods could be applied to those kinds of issues. So I just wanted to start with that. I'm now going to go on to the slides that I had intended to show. Excuse me, there we are. So Mark has just asked me to highlight a couple of areas where some of the research that that we're doing can be applied and can be useful. And really, I think the thing I'd like to highlight is actually that the methodological innovation doesn't need to be very advanced. So we don't need to take these incredibly sophisticated AI models or machine learning models. There's much lower hanging fruit that we can do to really find interesting, useful things in these kinds of systems. So one example I'd like to show you some work that we did looking at the distance that kids travel to school. So in the UK, the distance, the way that schools are allocated is pretty confusing, and it's different in different local authorities. And in Bradford, by taking the connected data, we were able to look at where children were going, which schools they were assigned to, how far they went, what kinds of experiences they had. And we found, for example, that there was a 42% lower chance of someone attending a good or outstanding, so these are the top ratings for most schools, if they lived in one of the most deprived areas. And no one is intending this to happen. There's no policy that says that this should happen. This is just an outcome of the way that the system works and the way that the kids are kind of exposed to the different ways of applying for schools. We also found that children in the least deprived areas were 5 times more likely to receive an offer. So the children in the most affluent areas were 5 times more likely to receive their top school, the one that they asked for first, than kids in more deprived areas. This meant that some kids had an extra, say, half mile to commute to school because they weren't getting their top choices. And it was only by looking at the data holistically, which amazingly hasn't really been done before, that you're able to start to identify these patterns, and then you can start to look at policy change. So you can work with Department for Education and start to ask questions about why this is happening and what can be done to make the allocation of kids to schools more equitable. So that's just one example. Another one that we are looking at is what some of the reasons are behind children leaving school at 16. So when they finish their exams, they should go into 2 years of further education or other types of training or employment. And by linking the education data, which tells you if kids are dropping out of school, basically, with the health data, you can start to identify some of the indications for why the kids might be leaving. And what Mark and others have found is that some of these very early assessments that are done with children when they enter primary school, so really early on at like 4 or 5, can link to becoming neat later in life. So you could have something that happens at 5 or 6 that is then kind of almost the start of this trajectory that Anne talked about earlier. And again, it's not very complicated, the methods to do this. It's just by having availability of the kind of linked data sets in Connected Bradford that make this kind of research possible. And then very finally, because I want to move on and hear what our colleagues in Stanford have been up to, we're also able to look at absences in schools. So we can see how many children are absent from school for whatever reason, and we can look back in time at this. And amazingly, this hasn't been done either, but we can look at what effect COVID had on different schools. Why was some schools were able to stay open more often, why some classes were able to stay together, why other schools, closed entirely, or at least, shut down whole classes. And again, by looking at the schools data and by linking it to the health data, we can start to see, well, are there some reasons why some schools are much better able to stay open, and diseases like COVID and other, more common diseases, why they're not transmitted in the same way. And again, it doesn't need to be too complicated. We don't need really advanced AI and machine learning to do this. But by looking at the connected data in a kind of holistic way, we're able to get some of these insights. And I'm going to leave it there. I hope
Thank you, Nick. I'm going to keep our presentations rolling, and I'd like to introduce Isabella Chu from Stanford University. Over to you, Isabella.
Thank you, everyone. My name, as she said, is Isabella Chu. I am the Associate Director, the Associate Director of the Data Core at the Stanford Center for Population Health Sciences. And today I'm going to be talking about sort of the rationale for synthetic data. So the mission of Stanford Center for Population Health Sciences is to improve population health and to elucidate the social and environmental determinants of health. And the mission of the PHS Data Core within the Stanford Center for Population Health Sciences is to build a data ecosystem to make high-value health and behavioral data available to population health researchers easily, efficiently, and safely. And we have reached the conclusion that synthetic data is an important component of this. We deeply value our partnership with Bourne & Bradford, and in a recent discussion, we concluded that the area where Stanford could add the most value is in data science and using the powers of Silicon Valley for good. So that was really the genesis of this discussion. I'm having trouble advancing my slides. So we started about 7 or 8 years ago in 2016, and we acquired 3 large claims data sets because of America's peculiar health system. A lot of good health data is in billing records, and so these data sets had between 140 million and 11 million people in them. They couldn't fit on any computer, and even servers had a hard time accommodating them. There was no off-the-shelf cloud-based solution at that time that was affordable or appropriate for academic institutions. So we secured a grant from the Sloan Foundation and built a secure data ecosystem. And so today our data sit on a secure Google Cloud platform. There's a software layer over that manages data discovery, exploration. There's a GUI that you can use to reshape and cut the data that writes apparently very nice SQL code. I've been told the code's very good. And then researchers can then manipulate the data, pull their cut to a Jupyter notebook on the platform, and toggle between R, data, Python, whatever they like to use. The second thing we did was really professionalize data management. And I think the EU and the UK are way ahead of us in many respects on this idea that managing the data for use by many people is really an elevated role, and it's central to good research, whereas in the US, quite often it's federated, where the grad student does that, and then maybe the postdoc does the analysis. So we hired a fantastic group of data managers who annotate the data and manage the data professionally. And then finally, we wanted to bring researchers to the data. So because we combined high-value data, a secure computational environment, and professionalization of data management with wraparound services, we've been able to scale and had over 1,600 members, Stanford and the community, using our data, over 3,000 projects and hundreds of publications. And encouragingly, this technology and the model has been adopted by other research institutions in the United States. So thinking about what makes a data set high value, and again, Bradford has really exemplified this, is the ability to combine lots of different kinds of data. So is it large? Does it represent the population from which it's derived? Again, this is more of a challenge in the US than in the UK. Is it longitudinal? Are there multiple observations over time? Is it dense? Is it rich? And is it linkable by individual? So you can't really evaluate or do causal inference unless you know what happened to a person and when and sort of what the outcome is. The problem is that the better the data are for population health research, the higher risk they are. And the more you have to limit access to them and the more friction you have to introduce for access. And so we really believe that synthetic data has the potential to alleviate a lot of this pain. So this is just a quick overview of some of our, what I would call marquee data sets. Even though we have, 74 data sets, the bulk of the research gets done on a handful of our data sets. The American Family Cohort is about 8 million electronic health records from throughout the United States. It is rather unique in that what happens in the US is a lot of research gets done on Harvard and Hopkins and Stanford patients and quaternary and tertiary care medical centers. This is a primary care data set in the real world. And these are regular clinics in rural areas and underrepresented populations. We have a large commercial claims data set. Again, much of the health data is held by private entities and you have to buy it. And then Medicaid and Medicare are a national health plan. Medicaid is for low-income individuals, many women who are pregnant, people who are disabled, and many children are in this plan. And then Medicare is almost everybody over 65. So the challenge, again, just to recap, is that the better data are for population health research, the harder it is to share them. And the more friction and regulations there are around what you can and can't do with them, et cetera. Linking data sets increases the risk of de-identification, and at least in the US context, quite often there are prohibitions on linking because of this risk. And what we have discovered is even if there's a willing partner and a willing data owner like Bradford, it is illegal or impossible or impractical to share data across either national boundaries and even organizational boundaries sometimes can be very challenging. So what is synthetic data? How does this solve this problem? High fidelity synthetic data retains the properties and behaviors of the original data. It behaves like the real thing. It's indistinguishable with respect to variables and sort of how it behaves in models. But it doesn't have any real people in it, and consequently does not carry re-identification risk and is not subject to a lot of the regulatory constraints. Certainly, there are still proprietary risks and things like that that have to be managed, but it vastly reduces the risk profile and the personal risk associated with the data set. And so this here is a slide looking at sort of the continuum of risks. So if you think about research identifiable files, these very, very rich linked data sets, limited data sets have more information removed. So those first two are what most researchers want to work with. Again, de-identified data or pseudonymized data have existed for some time, but what's unfortunately happened is as AI and other methods advance, de-identified becomes a very slippery concept and a moving target. Like you have to do more and more and more to de-identify data. If someone clever could, with access to another data set, for example, could potentially get a hold of it. And so the next sort of form of de-identification is synthetic data. We really believe that this presents an excellent solution to this problem. And so with that, I'll let my colleague Ian talk about how we're going to do this.
Thank you, Isabella. Yep, straight to Ian Vala from Stanford University. Thank you.
All right, thank you. Share my slides here. All right, thank you, Bella, and everyone for such impactful and inspiring talks. Yeah, my name is Ayn Wall. I'm Associate Director of Cloud Computing and Data Science at Stanford PHS and work very closely with Bella. So I'm going to talk about the rationale for synthetic data, obviously, and the recent advancement and what we're working on now at Stanford. Yeah, so a lot of people are familiar with this. There is a tension between researchers and data custodian and owners. And at Populational Sciences here at Stanford, we are both sides of this coin on daily basis. On one side, the researchers want to get access to data quickly, gauge the value of data, maybe write proposals on it. And they have this moral imperative to make the highest and best use of data. And they work in the spirit of discovery and open science and efficiency and getting access to rich information. On the other side and right side, for very good reasons, we have these limiting GDPR and HIPAA rules that limit some of this access and work. There's public perception of of a data owner sharing the data with researchers. There's a huge cost of secure systems to host the data, and just risk aversion is very high. And sometimes even data owners have business interests. They think their data is valuable, and they can't really collaborate with other entities. So straight into it, why now? There is a huge rise of synthetic data usage now, and didn't really exist until very recently. And I personally think it's because of three different reasons. One is availability of compute. So computation, there's compute environments that are secure and scalable in cloud environments. For this case, synthetic data is very, very computationally expensive, and you really need large and scalable cloud environments if you really want to do that on large data sets. The second one that most of us are now familiar with these generative AI algorithms are now maturing and coming to our lives. It started from generative adversarial networks in early in 2014 and up until 2017 and 18. And recently with transformers and diffuser models, you can see that generative AI algorithms are doing very, very well. And some of those examples, of course, applications like DALL-E or ChatGPT. So those are really coming around nicely. And the third one, which is I think is a bit more honestly interesting, is this democratization of data science skills. And now a much wider range of researchers need access to data. Back in the day, maybe a few years ago, there was only few computer scientists or data scientists who would actually touch data, and they would collaborate with other people with domain knowledge. And now everyone wants the medical students, the EP student, they all need to touch data, they want access to data, and they know how to do that. So all these three coming along, and it's making a case for synthetic data. And what you see on the right is actually a plot that Gartner had saying basically synthetic data would be more than real data by 2030. And they had this 6 months ago, I think. Now they would even make it more extreme case in the past couple of months. So I'm going to give you just a quick example that we have done. We have this data set to predict stroke in patients. It's a curated data set of around 5,000 patients. And in the blue here, you see it's the original and real data. And the gray is the synthetic data. So if you look at one table on the blue one on the left, this is a table with patient ID and gender and age, some comorbidities of hypertension, heart disease, and the goal is to predict stroke in patients. And the gray one that you see in the bottom is the synthetically made version of that table. And I apologize if it's too small for some of you, but with just looking at it with naked eye, it looks very similar, and you can't really tell which one is synthetic, which one is real. So in the world of making synthetic data, this is sort of, as we see it, as a bare minimum to at least looks very similar to people. And on the top right, there's a little bit of statistical and distributions that you can look at. So to see if a part of your data for each variable were maybe oversampled, undersampled when synthetic data was made, and sort of just visually look if the data is different between the two. We also have scoring system for each of those variables in the data. In the bottom there, it's a bit more interesting. That's sort of the synthetic data, not a quality, but more of a utility of that data. So in this case, we ran several machine learning models to predict stroke in patients using the data. And what you would like to see is synthetic data performing similarly to the real data in doing that, because then that would show that the underlying trends, at least the ones that were relevant to stroke, is the underlying trends of data actually still kept the same with high fidelity. So this is a quick example of what we have done. But what we're working right now, it's really benchmarking the synthetic data after you generate it. You sort of benchmark it, and you want to see what's the quality of it. So in the top is what I described a little bit, summary statistics. We assess correlations between fields. For example, if the a BMI goes up, you would want to see the risk of diabetes also goes up when you look at data for patients. So very, very simple, and some other distribution stability that I showed. So summary statistics is one bucket for reporting. The other bucket is a synthetic quality score. So we're working on these, like recommending the appropriate level and application for the synthetic data that is made. So right now it's into three levels. One is the data looks kind of the same. So it's great to simulate a test environment, maybe share the synthetic version with the researchers and see if the data dictionary and distribution is what they're looking for. And that's how they would get started with working on the data and the real one. The second level is a synthetic data useful for improving previous model development results. So I don't want to get into too much details, but synthetic data is actually going to be very helpful for better machine learning model development. And the third one is what you would like to really have is the synthetic data standalone for analysis and its high fidelity. So that's that bucket is to increase the quality of synthetic data. The third bucket is really the privacy level recommendation that we really care about, because we work with high risk data. And the reason for that is, you want to assess the privacy risk associated with the synthetic data. Basically, you want to measure it to see if there is re-identification risks. Yes, the synthetic data doesn't have real patients, but you want to make sure it doesn't have real data. And it's not too close to the real data, because that also may cause re-identification risks down the road. So if more privacy deemed necessary, we can add privacy-inducing algorithms such as outlier filtering or similarity filtering and differential privacy. So with adding noise to the data and clipping some of the variables, you tend to make the data more private. And so you get farther from a very accurate representation of synthetic data, but you have a more conservative data set for the application that you have for the synthetic data. So there are knobs that you can turn and maybe even have a different version of synthetic data for the data at hand. Yeah, so very quick, current and near future work that we're working on is synthetic version of our own data sets. We're working on grants and things to be able to do that. We also work with looking for partners with data who would like to collaborate on such a very similar mission that we have. And also we have researchers to validate use synthetic data. And some use cases, for example, we have a big project in infection disease, specifically COVID-19 with CDC in the US side. And we would like to make, after making a synthetic data version of it, does the COVID-19 trends really still similar to the original data? And if that's the case, the data that we are working on for this particular work is very high risk. So it's not something that you can really share, but maybe a synthetic version of it, you can do that. We have one with mental health for adolescent mental health in US, and for people who are involved with mental health data, you would know that it's very difficult to share and collaborate in such data for good reasons, specifically, you know, across nations. So synthetic data could help with that, and climate change and other things that we're working on. But yeah, you know, the world of synthetic data and generative AI is moving very, very quickly, but it's certainly very exciting. Hopefully, we can solve the real problems that we have with it. Yes. Feel free to contact us for any questions.
Thank you, Ayaan. Yeah, that's brilliant. Thank you. And your contact details are on the screen there. What I was going to say is thank you to all 4 speakers and your presentations. If you're interested in the speaker biographies, please click on to the link which was in the invitation, or you can find it on the CARE website. I do want to give time to Professor Mark Mann-Williams, to hand back to him to just say a few words in terms of summary and to help close our session this afternoon.
Oh, it's just humbling, isn't it, sort of, Catherine, to see everybody coming together with all those different sort of skill sets, and everybody basically saying, this is what I can bring to the sort of table. This is how we can work together. It's you know, where do you start with sort of thank yous? Thank you so much to all the sort of speakers, but it's been inspirational, and what an amazing 90 minutes I've just had. Thought-provoking, sort of very challenging, but ultimately inspiring. And I think the question now is, how do we just put that in a bottle and use it and sort of live off it over this next year? This is a once-in-a-lifetime opportunity for us to do something really, really special here, to start harnessing the power of sort of data sort of science, bringing together an international community that can do, you know, really, really exciting, cutting-edge research that's going to make a difference to people's sort of lives. It doesn't get better than that. Hopefully it's just given a flavor to our colleagues across in sort of Stanford about the amazing resources that we possess across here, but also the appetite of our incredible practitioners and incredible policymakers to take those sort of findings and use them to drive forward sort of a change. And I think that's really exciting. If we can start just showing how data science can actually build a better world, then I think the dominoes start falling, and we can all then use that to start the dialogues that need to happen, not just in sort of Bradford, not just in Yorkshire, not just in the UK, but globally. So a huge thank you to colleagues from sort of Stanford for joining. I just hope this is the beginning of a conversation between our colleagues in California and our community across here, but ultimately a conversation that's going to happen across disciplines, across organizations, across sort of geographical sort of boundaries. This is about everybody joining our community. What an amazing community, what an incredible start to this journey. You will be hearing from us. We will be circulating all the materials that have come out from this, and we'll be doing everything that we humanly can at this end to really sort of push this sort of forward. But it's only going to be successful if people do join in. I'm excited about the fact that we've got a clearly identified sort of project. I just find it's really useful just to get the ball rolling. So this is a great way for us to start. I put in the chat the fact that sort of Bella's driving forward a fantastic proposal that we're going to put into the Wellcome sort of Trust to get the resources that we need to start creating the synthetic data sets, which are going to give us the ability to really do some sort of special sort of things over the long term. But as Nick beautifully illustrated, just right here, right now, without using any particularly fancy sort of technique, improve people's lives. So let's start making that happen. So I'm just going to say a huge thank you to everybody for coming along, and just please stay connected, stay part of this sort of community, and together we can turn the tide on those terrible problems that we've heard too much about for too long. This is the time right now when everything can change. And I'm fond of always sort of saying at this sort of stage, if not us, who's going to do this? You know, we can just sort of sit around and wait for that other community. It's not, there's no other community out there. We are the community. We have a moral responsibility, civic responsibility, ethical responsibility to use our talents to change things. So let's use this as that marker and stand. This is the point at which everything starts to change. So thank you, everybody, for coming. Thank you so much, Mallory, Catherine, for all your organisation and getting this on the road. And as I say, let's just use this as the starting sort of a pistol. The race starts now.